Um, which of the following is the most appropriate treatment for this patient? 4-month-old girl brought to the pediatrician by parents, or yeah, by his parents. Poor weight gain, difficulty feeding. There's no family history of congenital heart disease. On physical exam, the infant is in mild respiratory distress, a loud systolic ejection murmur, best heard at the left upper sternal border, does not radiate to the back. Echo confirms presence of a congenital heart defect involving.
This is George Ezra from Spotify.
Echo, stop. Sorry.
No, that's okay.
Echo, stop. Pulmonary valve. Most appropriate treatment for this patient. Okay, so loud systolic ejection murmur, best heard at the left upper sternal border. And it's a congenital heart defect involving the pulmonary valve. So so we have something, yeah, going on.
So first you got to ask yourself, what, you know it's a pulmonary valve issue, right? They give you the
Yeah.
location, they give you it's a systolic murmur. So, on a normal person or, in general, just what can cause you, systolic ejection murmur at the pulmonic area sound? Is it stenosis or regurgitation?
Stenosis.
Okay, good. So you're thinking, okay, some kind of pulmonic stenosis here. That would be kind of your working diagnosis, right? So let's say that's kind of, what you're thinking here for this 4-month-old infant. What do you want to do now that you've kind of figured it out?
So he has poor weight gain and difficulty feeding. So I don't think at this point we want to just observe and reevaluate. We need to make sure we're at least on top of this.
Okay.
I don't know. I don't really hear of using ARBs in like an infant. I don't know if that would solve our problem either. Well, we don't have like O2 saturation or anything. I would um I would maybe refer for surgical repair. That might be too much, but we'll start there.
Yeah, I think it's a great way to start, right? So you have somebody, right, that is symptomatic, right? A kid with poor weight gain, difficulty feeding, respiratory distress, right? Pulmonic valve stenosis, right?
Yeah.
So of course, right, if you leave this for a long time, right, it's gonna cause many issues, right? Right-sided heart failure, right? And then leading up to systemic congestion, right? So edema, right, liver damage, etc., right? So you want to relieve a structural issue with a structural solution, right? So the only structural solution is, hey, maybe we got to operate on this to fix this, right? So nitric oxide, right, can help with pulmonary hypertension, but it's not going to fix the valve issue. Digoxin, right, can help with the symptoms of heart failure and arrhythmias, but once again, you're not fixing the structural issues. ACEs and ARBs can help with hypertension, also, kind of decrease the work of the heart, right, by decreasing the blood pressure. But once again, not fixing the structural issue, and observing and reevaluating 6 months while the kiddo is definitely having failure to thrive is not good. You're just kicking the can down the road, right?
Yeah.
All right. So